I am the Community Outreach Advocate, and MTM is the company that provides transportation to members on Medicaid and Nevada Checkup. So we'll be going through an overview presentation of the services that we provide. I always recommend this information is very important, so take notes, and at the end you will have the email to access me. There are some frequently questions at the end as well, so it is important to stay through the entire presentation to make sure any questions you may have regarding this service are answered. And of course, at the end of the presentation, you will have my email, so you can email or contact me with any questions that you may have. So a little background about MTM. We have been around since 1995. We're actually a nationwide company. So if any of you caseworkers or social workers find yourself that you're covering different states, it is good to have a relationship with MTM because we are in multiple states and continuously expanding. Some states offer more programs than others. With the state of Nevada, we are strictly medical transportation. Some statistics that are more localized to Nevada. I always like to point out that we have a 92.99 customer satisfaction rating. This survey is done by a third party. So as you can see, we are a pretty solid company here in Nevada. Some important updates to consider regarding MTM this year is that beginning of January, Nevada Medicaid is expanding managed care statewide, including rural areas for the first time. Facilities in rural areas should be aware that managed care organizations may now be responsible for coordinating non-emergency medical transportation services for members. If any of your clients that you are helping with this service are in Pahrump, they would be considered rural. For assistance, you will have the member contact one of their managed care organizations. That would either be CareSource or Silver Summit. They will have to contact them directly to get medical transportation. It's exciting to announce that we are taking Nevada Checkup this year for non-emergency medical transportation. Please inform any Nevada Checkup participants that they can now request MTM services for their children. Going through with reservation information. So who can request transportation? Of course, the members need to be at least 18 years of age or older. Basically, anyone can request transportation on behalf of someone for MTM as long as they're able to verify any HIPAA information. And when it comes to recipients who are emancipated or minors who are seeking family planning services, they are also allowed to request transportation on their own. They would be the exception to the 18 years of age rule. So who is eligible to receive non-emergency transportation? Medicaid fee-for-service participants. So this means that if they're in a rural area or if they're in Pahrump and they have fee-for-service Medicaid, they are still going to call MTM for their service. We take managed care organizations, including United Healthcare, Anthem. In Las Vegas and any urban cities, we are still taking Silver Summit. So any Las Vegas participants who have Silver Summit, they will still be calling MTM for their transportation. And excited to announce Nevada Checkup participants as well. Non-qualifiable recipients are any Medicare beneficiaries. If they have Medi-Medi, MTM will only be responsible for the appointments that are Medicaid billable. So something to be very aware of, especially for those Medi-Medi participants. Information needed to book the trip. You know, of course, all member HIPAA information, the date and time of appointment, the time a recipient needs to be picked up and returned home, medical provider's name, address, and phone number. It is imperative that we provide any specifics needs the member may have at the time of intake. Please be aware that at the end of the day, it's just a file on our screen. So we want to make sure that we add any notes, anything specific at the time of intake, so we can start customizing the members' notes and their file to fit their needs. The modes of transportation we offer, so we call them modes. This will be the type of service that we are able to provide to a participant. And MTM has a variety, as you can see on the screen. We have fixed bus routes. We offer 8A paratransit door-to-door services through the RTC. We have gas mileage reimbursement options as well. We have community professional drivers. We use Uber and Lyft. We also have wheelchair capable vehicles. We have stretcher vehicles, and we do use commercial airline and Greyhound bus when available for this specific type of trip the member may have. For our gas mileage reimbursement program, the trips must be scheduled prior to the appointment time. So they can schedule it a week in advance, they can schedule it a day in advance, they can even schedule it the same day. It just needs to be set up before the member goes to the appointment. We do not backdate. We have something called a trip log, which requires medical professional signature or anybody at the medical office. The front receptionist can sign this information for them as well. We just need to verify that the member has gone to the medical office where they are being treated. Any altered trips will be denied, so this is very important to let our members know, especially when it comes to um, their handwriting. If they cannot read the information on the log, it will be denied. They can also not white out information. If there is an error that has been done on a trip log, they can just cross out where they have made the error and then jump to the next section where they can start over. And of course, we do not require trip numbers, so if the trip log asks for trip numbers, the member can feel free to leave that blank. Trip logs can be sent via email, fax, or mail. Of course, email is going to be the fastest way to get these to MTM for approval. Recipients has 60 days to submit a trip log to MTM. The current gas rate, I know this is a little silly, but it is 20.5 cents per mile. So not exactly 21 cents, but a little more than 20 cents. Payment will be made on a reloadable debit card. MTM Link member mobile app can be used for gas mileage reimbursement in place of trip logs. And this is verified by our GPS location data through the app. Transportation of minors. Anyone under the age of 18 must be accompanied by an adult 18 years of age or older. 2 passengers are accompanied for are eligible for participants under 12 months old. If a parent or legal guardian is unavailable, a parental consent form is required. Please note, these will be reviewed by Medicaid on a case-by-case basis. A good example of when a situation might occur that this would be approved is if the participant is obtaining family planning services. They are more than likely to get a parental consent form on their file, and then they can go to their appointments by themselves. But for the most part, we do require an adult to be present. When it comes to additional passengers for anyone who's older than 12 months, a recipient is allowed 1 additional passenger per when a medical necessity form is on file. So what this means is the state of Nevada only allows an extra passenger when an escort is needed for medical reasons. A good example of this would be if somebody is maybe getting their wisdom teeth taken out, the facility requires a signature to release the member back home. They would want to bring an escort with them. And at the time of intake, this would have to be communicated to our customer representative so that can be placed on their file. Trip scheduling options. So when it comes to scheduling, we have something called a web chat. So you can check eligibility on this website. You can also do follow-up uh, questions. You can ask just basically any follow-up. You can actually set a gas mileage reimbursement trip through here. But for everybody on this call, any social workers, caseworkers, peer support workers, all of them are required to call the community partners line, and I will have more information of that down the slide deck. But if you just need to check eligibility or have a quick question, you can go ahead and use the chat. And it is quick and it gets you to a live representative. So when it comes to trip scheduling options, the app is only available for viewing purposes and verifying gas mileage reimbursement. Our participants cannot set up a trip through the app. They must call the contact center. How to schedule a ride. As I mentioned earlier, please call the community partners line if you are a facility or from an advocacy group or any agency that assists with transportation for Medicaid recipients or Nevada checkup recipients. The phone number you will be calling is the phone number on screen. We are open 24 hours a day, 7 days a week. This phone line is especially coordinated for facilities, so they do have special access for your facility and are able to verify or set up any urgent trips and verify all matters through the community partners line. We do have days notice requirements for the state of Nevada. We require 3 business days to set up any routine appointments. We require 14 days to set up any long distance appointments. And for hospital discharges, we do ask for a 3 hour window to facilitate any hospital discharges. So this is important to know, especially in Nevada. I mean, we have a really good relationship with Uber and Lyft here. So if somebody gets discharged and is able to use that service, it likely will take less than 3 hours. But just be mindful because that will mean that a participant likely will end up waiting a while for medical transportation if maybe Uber or Lyft is not available to them. Routine appointments. So this is for members. They will be calling the community partners, sorry, they will be calling the scheduling line at the phone number that you see on screen. We have two types of appointments we recognize here at MTM. We have our routine appointments and urgent appointments. As you can see, they will be dialing the same telephone number for each appointment. And we are a 24/7 company. So even if they have a routine appointment they are scheduling after hours, we will still set it up in the portal for them. If routine appointments is an appointment that does not require a recipient to be seen right away, so think of these as your standard doctor's visits, a dentist appointment, anything that's scheduled ahead of time. Routine appointments can be scheduled for the current and following calendar month. When it comes to urgent appointments, these appointments are where 911 is not necessary, but the recipient cannot wait 3 days. So as you can see, there are some examples on the screen, and we will set up transportation for them the same day if that's what is necessary. Online forms. We have our forms online on our website. It is mtm-inc.net. Or the best way probably to do it, you can put Nevada MTM on your Google search bar. It will pop up right away. We actually have a special web page just for Nevada that is specific to Nevada's information for the state. So all our forms can be found out on our website and can be actually filled out on our website as well. We have a distance verification process when it comes to certain trips. MTM Medicaid does not have a mileage restriction or limitation. As I mentioned earlier, we cover the entire state. So if a trip requires the member to be taken more than 101 miles out of, apologies for the interruptions. If a recipient are to they need to make a trip that is more than 101 miles, we will need a distance verification form so the health plan can approve it. We just want to make sure they're going to the most nearest appropriate provider. An example I have here, if a trip is going from Reno to Las Vegas, it must be verified to ensure the nearest, most appropriate provider is being used. The form is to be completed by a referring physician, and as I mentioned earlier, all forms can be submitted online. When it comes to public transportation, MTM arranges fixed bus routes and paratransit services with the RTC. A paratransit service is a shared door-to-door ride for recipients who may have a disability that prevents them from using the fixed bus route. Recipients must be certified by the RTC through an in-person interview and functional assessment. MTM Health will set up transportation for the requested mode for up to 45 days during the assessment period. If they are denied by the RTC will be the one who makes the approval of whether or not they will be receiving door-to-door transportation. So if they are denied by the RTC, the recipient still has MTM with gas mileage reimbursement or the public bus, and we will give them money for bus passes. The way our bus passes work for Las Vegas is we have two options. We provide a monthly bus pass and a daily bus pass. MTM Health will provide a physical or multiple ride pass when cost effective. MTM Health distributes monthly bus passes at state welfare offices, and recipients pick up passes in person with a picture ID. For the daily bus pass, we will send a US bank card. This is also the same US bank card we send out for gas mileage reimbursement. They will be emailed to the member's home. They can keep this card for the entirety they use MTM, and anytime they have a trip that they need to go and have a bus pass for, we will send the funds 48 hours prior to their appointment time to the US bank card. We also have a travel training program. So our travel training program is pretty nice. Our travel trainer is his name is Lorenzo Mendez. You can email him with referrals on the email you see on screen. And the great thing about him is as long as the person has Medicaid, even if they don't have a doctor's appointment necessarily scheduled, he will still come to their home and teach them how to use the public bus system and show them how to use the routes. So it's a great service we offer, and it can also be used for any Medicaid participant. Scheduling hospital discharges. If your facility has a hospital discharge to schedule, it is imperative that they call the community partners lines. Discharges are accommodated 24/7. You can call as soon as you know the patient will be discharges, and discharges can be scheduled for the following day as well. I do have a checklist for hospital discharges that can be emailed upon request. Kindly note, our hospital discharges require verification from the nurses station. In order to set up appointment, we have to verify that the member has been discharged by the facility. For our return ride process, what I would like to point out from this slide deck is that if you are scheduling a ride with MTM, please ensure that you set up set appointment times. So if the member's appointment is at 10 o'clock, but they want them there to be 15 minutes prior, their appointment time will be 9:45. And for the return time, if the appointment, maybe they're going to just the primary care appointment is just a regular checkup. So if the appointment will last an hour and it's at 10 o'clock, please have them schedule a pickup at 11 o'clock. If you're not sure or you want to give a little bit more time for the participant to have, you can schedule a return time that is a little further out. So if their appointment ends at 11, but you're not sure, maybe this facility is notorious for taking extra time, you can set up a return ride at 11:15, 11:45. It is better to have set times because you know the provider will be there. We also have a function that is called a will call. This can be set up when a pickup time is not necessarily, it's open-ended. The provider can take up to 1 hour from the time of the call to pick up the recipient. So when it's set up for a will call, it is an open-ended return time. The member is responsible to call MTM to let them know that they are ready to go home. And, depending on traffic and depending on the provider's availability, this might take up longer than an hour for them to be returned home. Call expectations. During the call, the customer representative will recap the information taken during the time of the conversation. On the day before the appointment, the transportation providers are required to call 24 hours prior to the appointment time. And on the date of the appointment, if the ride is ever more than 15 minutes late after the estimated pickup time, we please instruct the member to call MTM. Another note, MTM will not call the member with ETA time. That is the responsibility of the medical transportation provider. If they are not receiving that call from the provider, they are to call MTM and to follow up. Recipient and driver expectations. We expect our recipients to be thoughtful, as this may be a share ride, to bring travel equipment, as less a wheelchair or car seat, no smoking, eating, or drinking in any vehicles. Water is the only exception, with a reasonable water bottle, of course. Never smoke around the member. Do not use cell phones unless it's in hands-free mode, and never touch a recipient unless it's appropriate to do so for assistance. The community partners should contact MTM at the community partners line on screen. If you have any questions or concerns or need additional support, please send me an email at co-nv@mtm-inc.net. Here are some frequently asked questions. Does MTM Health provide assistive devices for discharge patients? No, we cannot require our transportation partners to carry wheelchairs or car seats. The recipient must bring self-administered portable oxygen tank units on vehicles. This also includes wheelchairs, car seats, and oxygen tanks. Does MTM Health provide transportation for hospital-to-hospital transports? Yes. So we provide MTM Health provides transportation of medically stable recipients to a location where organ transplant will occur, non-immediately medically necessity transports, hospital-to-hospital transports, and hospital-to-mental health transports. Other services we offer out-of-state transportation to Medicaid enrolled providers. So, for example, if members may be needing to see an oncology specialist outside of Nevada, as long as they are going to the most appropriate provider, MTM can help facilitate that. We also cover it with meals and lodging, and we also do attendant travel. We only cover the way to the facility with the member. We do not cover when the staff is traveling back without the member. If you ever have a complaint, please call the number you see on screen or send an email to our quality management department at the email on screen. If you have any further questions, do not hesitate to send me an email. This is important information in Nevada Medicaid. They have changes or updates they make throughout the year. So I understand some information can get confusing. Just send me an email to follow up. Thank you so much for attending this presentation and have a wonderful day.